Well, good afternoon, everybody. I'd like to welcome you here today. I'm Terry Lake, the CEO of the BC Care Providers Association. And first, I'd like to acknowledge that our offices are on the traditional territories of the Coast Salish First Nations, the Musqueam, the Squamish, and the Tsleil-Waututh. And we would like to extend our appreciation for the opportunity to hold this dialogue here today. I'd like to welcome all of our participants today for this important virtual Care to Chat that's entitled Not Nurses, Not Nannies. Can foreign trained healthcare workers help to solve Canada's nursing shortage crisis? Let's start off with some Zoom housekeeping, as we always do. We want to make sure your experience is optimized today. Your microphones and cameras will be off throughout the session, but I encourage you to use our question and answer function at the bottom of the screen there. And if we have time at the end of the session, we'll be going to those Q&As that you can pose to the panelists. I want to set the stage for this discussion with a little video that Mike Klassen and our crack communications team has made in order to kind of outline the challenge that internationally educated nurses face when they come to Canada. So let's take a look at this world premiere of the video on internationally educated nurses coming to Canada.
Canada is facing a critical shortage of healthcare workers that everyone acknowledges but seems unable to solve. The reality is that our population overall is getting older. Recently, the number of Canadians over age 65 surpassed our youth age 15 and under for the first time. That's why some are calling that aging demographic an existential threat, on par with climate change. Older populations demand significantly more healthcare services, but if we lack enough workers to provide those services, where do we turn? There are thousands of internationally trained workers residing in Canada today who could have fulfilling careers in healthcare. So why don't they? For foreign-trained healthcare workers, the pathway in Canada is confusing and difficult to navigate, with so many paths and none of them with a clear end in sight. They're a lot like roadblocks. For example, if someone wants to work as a nurse in Canada, let's call our nurse Daisy. They are met by dozens of nursing regulators across the country, each with its own system for applications and a range of fees to apply. Undaunted, Daisy keeps going. But she discovers that the records of her education and employment history are held up by issuing bodies that have since folded or have lost them. Yet another situation out of her control to slow Daisy down. Next comes a test for language proficiency in English or French. For a surprising amount of workers like Daisy, not passing the test could put the brakes on a career move or discourage them from continuing despite being functionally literate in either language. Then there's the skills assessment testing requirements, a 3-part exam with an oral, written, and practical component. It has a $2,000 price tag to conduct the test. If Daisy has too many undemonstrated competencies, she could be on the hook financially to repeat some or all of that nursing education. Many of these education programs have waiting lists or promise results they cannot deliver, delaying Daisy's goal of working as a nurse in Canada for months and sometimes years. If, however, Daisy is able to move forward, she'll then have to write a nursing exam. Great news! Daisy has passed the exam, but the process so far has taken years, leaving Daisy paying thousands of dollars for training, travel, exams, and accommodation. At this stage, for Daisy to put down roots in Canada as a nurse, she'll have to navigate a complicated immigration pathway that does not prioritize internationally trained healthcare professionals. This process could take as much as 5 years or longer. For far too many internationally trained nurses and health professionals, the path becomes too complicated and leads to a dead end. There is a better way. At BC Care Providers, we're working with organizations nationwide to advocate for a simple and clear pathway for internationally trained nurses like Daisy. We're calling upon the federal, provincial, and territorial governments, as well as nursing regulators, to work with us to create a new streamlined approach. By expediting the ability of healthcare professionals to work in the field for which they're qualified, the sooner we can help solve Canada's health human resources crisis in seniors' care.
Well, we hope you allowed that video to set the stage for our discussions today, and we have shared the link in the chat. Please feel free to share that YouTube link with everybody that you know, so that we can make people more aware. Now, I'd like to introduce our sponsors for the event, including our title sponsor, Arjo Canada, a global supplier of medical devices and medical solutions. I'd also like to thank our gold sponsor, Point Click Care, our silver sponsors, the cooperators, Sobeys National Pharmacy Group, Surge Learning, and Care to Speak. And with that, I'd like to introduce our title sponsor, Jeff Blaine, Director of Corporate Accounts at Arjo, who will introduce our panelists today. Over to you, Jeff.
Thanks, Terry. Good afternoon, everyone. Arjo is proud to sponsor with BC Care Providers Association and support today's Care to Talk, Nurses, Not Nannies, the Cure to Canada's Aging Population. It is my privilege to introduce today's panelists. Cynthia Johansson is CEO and Register at the BC College of Nurses and Midwives. Cynthia began her career in health profession regulation in 2003 and has developed a true passion for regulation and public service. Next, we have Michael Sandler. Michael is Director of Nurses and Nurse Practitioners of BC. Michael has extensive executive nursing leadership experience with a solid background in operational leadership and clinical practice. Joining us from Ontario is Peter Rakai, the JD Certified Specialist at Rakai LLP. Peter has represented employers and industry groups seeking to facilitate the entry of qualified and talented individuals into Canada. Peter also serves as chair of the board of Rakai Centres, a not-for-profit company that run 2 long-term care homes in Toronto. I know we're all eager to start the conversation, so I'll turn it over to Terry to start our session.
Thanks, Jeff. And just wanted to recognize our silver sponsor. One of our silver sponsors is Care to Talk. We have Care to Chat, we have Care to Speak, we have Care to Talk, but Care to Talk has been very helpful in providing technology for seniors in long-term care. So we appreciate their sponsorship. And we also will have some guest questioners a little bit later, including Jeremy Sabel from Stenberg College, Thea Lopez from the Pacific Immigrant Resources Society, and Patrick McKenzie from the Immigrant Employment Council of BC. So we look forward to those questions a little bit later to further the discussion. But let's kick off now, and we'll start with Cynthia. And just if each of you will go to Cynthia, then Michael, then Peter, if each of you could just say why you think it's important to have this discussion and what you think you can bring to this important discussion today. Cynthia.
Thanks, Terry, and thanks for inviting me. I'm delighted to be here. I'm delighted to see the wide range of participants, and I'm quite honored to have the chance to share my thoughts with all of you. So, you know, I'll be honest, one of the great shifts that have happened, at least in my world, in the regulatory world for nursing, is that we consolidated the nursing regulators in British Columbia in 2018. And despite COVID, which of course delayed a few things for lots of us, we've been working hard to look at how we might streamline, make more efficient many of the processes in the organization, including the application process for internationally educated nurses. So this conversation is timely because work in our organization is underway. So there's some benefits there to be realized yet. And again, having the feedback from many of the participants today and the discussion, it's like perfect timing. So thank you. The other thing that I think is starting to shift, at least again in the regulatory world, is really thinking about the processes that internationally educated nurses complete, the requirements that they complete in going through the application process in Canada. What parts of those processes are adding value and what parts are maybe outdated, no longer necessary, could be done better or differently because technology has shifted. Certainly, Canada is a complex environment for internationally educated nurses. We have 22 different nursing regulators in Canada. Most other countries have just one, or even our counterparts to the south, the United States, would have one per state. So thinking about how that complexity and trying to navigate that as somebody from outside of Canada, and finding ways to rethink how we imagine the regulatory process, the registration process for IENs. So I think it's a great time to start having these conversations. Sometimes it takes a little bit of courage to put these outdated modalities onto the table and to question what value they're bringing to us at this point in time. So again, I'm really looking forward to the dialogue today, and I can't wait to share more of what we're doing at BCCNM.
Thanks, Cynthia. And I had the privilege of working with Cynthia in that amalgamation process when I was at the ministry. And I know I want to congratulate you. It was not easy to bring all those collective colleges together. Michael, over to you as the Executive Director of the Nurses and Nurse Practitioners of BC. Why do you think this is such an important topic at this time?
First off, Terry, thank you for the opportunity to be here and to discuss this important topic. As you noted, NNPBC is the professional association representing all 4 nursing designations in the province. And so, it's our job to be part of these conversations, to serve as the professional advocacy voice for nurses in BC, but also for nurses who want to practice in BC. As the video noted, and I'm sure this conversation will elicit throughout the afternoon, IENs play a critical role in adding to the nursing workforce. And we have been experiencing, as most people know, a shortage of health human resources, in particular nurses. And of course, we've been grappling with the COVID-19 pandemic, which is exacerbating the nursing shortage. And we are looking down a path that is showing that exacerbation is going to get even worse as a result of some of the other things that are happening in the environment. So, I see this as an excellent opportunity to get some thought leaders together in the room and figure out a way that we can manage this to the benefit of the citizens of BC moving forward.
Thanks, Michael. And Peter, from your view in Toronto, we've worked together talking to immigration officials on this topic. Give us your thoughts. And you're still muted, Peter.
Hi there. Does that work? Great, Terry. Sorry about that. I'm very happy to be here for 3 reasons. So this is a topic very close to my heart. Number one, I am the offspring of foreign doctors. My parents came out of Hungary in post-war era and landed up as refugees in Paris, waiting for somebody to give them landing papers. They knew that medical professionals were required in Canada, the United States, and Australia. They applied to all those places. The US didn't want them, so they didn't go there. Australia did want them, and they had permanent resident papers ready to go. But they heard that there was an extra year tacked on to residency and internship requirements in Australia that didn't exist in Canada. And Canada had just said yes to them as well. So pretty much based on that alone, they set off for Canada, landed in Montreal. We thought Montreal was delightful. Heard that there was an additional year of internship requirement for foreign doctors in Montreal. Heard that wasn't true in Toronto. Left, got on a train, came to Toronto, never saw the place before. We're a little surprised by what it looked like circa 1950. But settled in, ultimately started their own hospital, which was dedicated to serving all the new immigrant populations in Canada, and invented this thing called multicultural medicine. And all the nurses, doctors, nurses, administrative staff, and cleaners that they hired were all people with 2 or 3 languages so that they could serve the community around them. So of course, many of these were foreign trained nurses and support staff and doctors as a result. So, ultimately they were recognized for sort of being forefathers of multicultural medicine here in Ontario. They got an Order of Canada in Ontario, and things worked well for them to some extent because there was less bureaucracy in the province of Ontario than there was in Quebec and Australia, etc. So, that's it was a little lesson for me in how bureaucracy is pretty important in terms of attracting people who want to do good stuff here in the healthcare field. Secondly, I practiced law for 35 years, immigration law. Much of my practice involves these days helping employers bring in skilled people. And that's, all across the board. And so I've seen the different requirements for individuals coming in different professions and occupations. It makes a huge difference in terms of whether, again, good people want to come. No different from what it was in 1950. So my recollection of, nursing issues over the years and bringing in foreign nurses, they've been huge headaches for a lot of the reasons that we've already put forward and was seen in the video. Thirdly, as chair of the Rakai Centers, which are long-term care centers, we have come face to face with a shortage in healthcare workers. To some extent, nurses, not only is there a shortage, but of course the hospitals get first dibs on nurses. They can offer a better deal. So we're always second, behind the 8 ball when it comes to being a long-term care home. And Terry, as you know, we have a particular shortage that we're going to be facing in the future. We struggle now, but we're really going to be facing it as the months and years go by with respect to PSWs. And one of the factors that limit the number of PSWs coming in as immigrants, we have 300,000 to 400,000 300,000 or 400,000 immigrants, most of whom are going to be economic immigrants coming in year after year over the next couple of years. Very few of them will be PSWs. Some will be nurses. Very few will be PSWs. They have been classified as low-skilled workers, and therefore they do not have the path to immigration under our economic immigration system. Nurses don't have that problem. They are considered to be skilled, so they do have a path. They still have some challenges, but they have a path. So you and I, Terry, have been lobbying the minister now that they've changed the dictionary they use to recognize that PSWs, certainly in BC and Ontario, working for hospitals and long-term care do require post-secondary education of at least a year. So they've been upgraded, and now the ministry has to sort of adopt a new dictionary, which they're asking them to do pretty quickly. At that point, PSWs are going to have an important path to Canada. So those are all the reasons. I could go on. I won't.
Thanks, Peter. But you did bring up something that I wanted to explore a little further, maybe with Cynthia and Michael, and that is the value of internationally educated nurses. Obviously, we want to train more domestic nurses and healthcare aides, or PSWs, as Peter refers to them in Ontario. But Cynthia, what special value do you see that internationally educated nurses can bring to our system here in Canada?
Well, I'm going to speak about British Columbia because that's what I know best. I think our ratio of internationally educated nurses making up the entirety of the nursing workforce is between 18 and 20%. So a fifth. And that's just from the CIHI data that's pretty much available to anybody who would like to look at it. So as a province, we have always depended on health human resources, specifically nurses coming from other countries to fill our need. And I haven't seen that shifting. And so when I think about what value do they bring, they are a huge component, cultural and professional component to the nursing workforce in British Columbia. And we should celebrate that. And we should look for ways to ensure that we can, people always talk about barriers. And I think it's almost become a weasel word. To me, I think we need to find ways to enable them, internationally educated nurses, to get through whatever those processes are as efficiently and as succinctly as possible. And so, later we might be able to talk about some of the work that we're doing to identify those pathways and take those barriers, those roadblocks, as the video so nicely articulated, out of the way so that they can get through the system and into a work environment in the right place, the right fit for them as quickly as possible. So to me, the value is that they're willing, they're interested in coming here. They are a huge component of the workforce we already have in place. If we can look for ways to enable them sooner, faster, better, we should absolutely do that.
Thanks, Cynthia. Michael, your thoughts?
Yeah, to build off what Cynthia has been talking about, I mean, obviously Canada has a long history of welcoming immigrants from all over the world, and part of the immigrants that we do welcome are HHR, or nursing, physicians, healthcare, and so they contribute to both in hospital or in healthcare and out of hospital a vibrant multicultural perspective, which in the larger context is obviously important to ensure that we have a workforce that is representative of the society that we serve. You know, and this, as Cynthia noted, this is an ongoing issue. You know, in the 1990s, we had a nursing shortage in Canada that was estimated to be about 30% of the current numbers. And so we started to increase our IENs drastically related to that. You know, provincial health systems and independent organizations such as yourself started advertising for nursing positions abroad. We recruited IENs through international conferences, career fairs. You know, even the federal government got involved in the process and introduced the Federal Skills Worker Program, which was targeted specifically to healthcare, and in particular IENs. And if you look at the CIHI data that Cynthia was referring to, in 2007, IENs represented 7.8% of the total nursing workforce. And that ranged between 1.9% in Newfoundland all the way up to 15% in British Columbia. And then at the 2020 CIHI data that Cynthia has just referenced, RNs, we make up 9% of the total nursing workforce. And again, from East Coast to West Coast, IENs make up about 14% of the total nursing workforce here in British Columbia. So those numbers have remained remarkably stable over a 2-decade period. So I think it goes without saying that whatever we've been doing previously hasn't really addressed the issue, because the numbers, the data is stable. So as I think we'll have the opportunity to jump into some solutions as we move through the panel discussion. But I think the important piece is that we've recognized that the contribution that IENs make is important, and we recognized that 25 years ago. So now we finally have to come to the table and start actioning that.
Thanks, Michael. And you both have talked about the importance of internationally educated nurses to the workforce, and we know that the regulation, the licensure, it rests with the provincial government, and we're going to talk about that and what the particularly Cynthia's college is doing. But Peter, what role can the federal government play? Back to Michael's point about the 1990s, what can they do today to make those pathways easier? We'll figure out the accreditation, et cetera, later, but they first have to get here. So what can the federal government do in that respect?
Well, there's two bureaucracies. There's the bureaucracy we talked about and saw in the film in terms of internally and the profession itself here and the regulatory role. And then there's the immigration bureaucracy. And so there are two issues. One, if you bring over temporary foreign workers from certain countries, certain visa offices, which have to process work permits and visas, take an incredibly long time. And unfortunately, one of them has traditionally been the Philippines in Manila, massive office. They do have a number of problems they confront. They have some fraudulent documents. They have other issues. Nevertheless, they may take 9 months to issue a work permit. That should take another visa office, another part of the world, maybe a month to do. So you've got various visa offices that are known to be incredibly slow and have been for decades. So you got to fix that. If you want to bring these people over quickly, then you have to have the resources. You have to have the human resources at these visa offices or the technology to make this go faster. So, I mean, that comes to mind right away. And the other thing is, you, in some cases, are going to have to adjust the point system that we use to evaluate potential immigrants. And, the higher you score in points, the more likely you are to get invited to apply for permanent residence. Well, some parts of the healthcare world are going to get, the applicants are naturally going to get lower points for different reasons. And, for example, in the case of healthcare PSWs, we call them in Ontario, if they're only taking a one-year course as international students, they're going to get fewer, or as in their foreign colleges, they're going to get fewer points because they don't have a 3 or a 4-year education or a master's degree, but you really need them. So what do? You have to play with the points. The feds know how to do this. The minister can do this on his own without changing the law or without changing regulations. And they have done it in certain cases when there are certain priorities. Foreign worker program operates on labor market approvals a lot. Those labor market approvals can be sped up and employers can go through less bureaucracy. You really shouldn't have to advertise, for nurses on the basis that there are many Canadians who could do the job if you've already established that there are not many Canadians available to do the jobs. So why put employers through this sort of extra hassle of advertising these positions for 30 days in a very particular ways, et cetera, and the cost of doing it, both to employers and ultimately to the foreign workers. So those are all ways that the federal government can make their side go faster.
Thanks, Peter. That's really helpful. And we'll get to the sort of provincial recognition credentialing aspect in a second. But I want to move over to Jeremy Sabel with Stenberg College, a private post-secondary institution that does a lot of healthcare training. So Jeremy, over to you to pose a question to our panelists.
Thanks very much, Terry. And it's absolutely a pleasure and a privilege to be here. To be having this conversation at all is an enormous step in the right direction and towards solutions that I think everybody on this webinar is interested in finding. So it's just enormously positive, I think, to be having this discussion at all together with other stakeholders that care. So my question, and this is being directed, I suppose, at Peter. Education, I think, it is now, and I think it will remain, and it's indispensable part of the pathway to nursing employment for IENs coming to Canada, and certainly to BC specifically, which has probably, arguably, the highest such standards in Canada. What changes to policy do you think can be made at the federal level that would make that would better enable all post-secondary institutions, be they public or private, to better contribute to the recruitment and preparation of IENs for all levels of nursing licensure across Canada? Because although the bulk of IENs may wish to be RNs here, not all of them necessarily would. Some may wish to become psychiatric nurses or licensed practical nurses. Some may have completed their education overseas, but maybe did not gain any work experience or have not had the opportunity to gain work experience. They may wish to move into a carrier or PSW role. So since education has such a critical role to play, how do you see the government making policy change to facilitate our participation in the solution?
You're muted there, Peter.
I will never get this right, Terry. It's okay. In a year from now, I'll have it down pat. It's okay. Jeremy, it's a good question. There really are two streams of getting new Canadians into the healthcare field and becoming permanent residents. I mean, one is through the more traditional. You bring someone over who's already a nurse, get them registered, get their get all their qualifications assessed, et cetera. Go through the process, become a nurse, probably on a work permit initially, then make them permanent residents, et cetera. The other way to do it features another way that the government has really facilitated generally as a path to permanent residence for skilled people in general, and that is starting at the educational level. In other words, for obvious reasons, colleges and universities have welcomed foreign graduates. We're a little bit late to the game. Brits and the Americans are well ahead of us there, but now we're gung-ho to the point we're going wild about that. And we're recruiting across the world. We're sending recruiters across the world, having them come to Canadian schools. So in some respect, given all the current bureaucracy, both the internal bureaucracy within the professions and the immigration bureaucracy to bring over people who are already trained professionals in this area, it is actually easier and perhaps even more timely to just bring a 19-year-old to Canada to be a foreign student, even though that involves the foreign student fees, which of course are higher for foreign students. Have them go to a Canadian college, graduate with the nursing degree or whatever degree here in Canada, and then move on in the way all other Canadian graduates move on into the system. And I think that's happening. Jeremy, you're going to know this better than I do, but I think that is happening to a great degree for nurses. The area it has not been happening at is for PSWs, who have resisted taking any courses at community colleges across Canada because they're considered, quote, a low-skilled occupation. They have no path to permanent residence. And the joy of coming to a Canadian school for many, many people, in fact, most people who come here as international graduates, is because it's a stepping stone to a work permit that they automatically get for up to 3 years when they graduate, whether it's a community college or university, and then move on and apply for permanent residence, usually after a year of working in Canada. But nurses do have that. They do have that route. They're going to be a little short of points in terms of competition because they're only going to have 1 year work experience potentially. But if they've got work experience back home, that will be counted. So that's okay. They'll do all right. And for the PSWs, as I say, right now, no pathway. We don't get anybody, or very few people from abroad going to school to become PSWs. That will change if the new dictionary definition of skills are adopted by immigration. And PSWs will be considered as skilled occupations. They will now come into the college system and go through as nurses do. But that's the problem. In my view, and maybe this is looking at it also from the nursing home point of view, which I chair. It's been with the PSWs. Mm-hmm. You're getting nurses going through your system, through the college system. You have not had any PSWs go through.
Yeah, and that postgraduate work permit is so critical to getting into the workplace, we know. So, Cynthia, we already know that there are a lot of internationally educated nurses. I think I heard the BC Nurses Union say there were over 800 in BC just waiting to work. But as we saw in the video, and we've all talked about, the pathways are complex, labyrinthian. What are you doing to try to simplify this? You're leading work that you hope will be taken up across Canada. So please just give us a synopsis of what the nursing BC College of Nurses and Midwives is up to.
Thanks, Terry. So once we became a single college, we started to realize pretty quickly that applicants were applying to multiple regulators, because we could now see we had an application from one person for both the RN and the LPN role. 2 application fees, 2 processes. What a waste. So we are now in the process of consolidating that pathway for applicants coming to our college for registration in BC. And along with that, we have done some analysis on what is the best indicator of an individual's success in the role that they've applied for. And what we have in the past always counted on is the assessment of educational credentials from their country of origin. And absolutely, that does give us some information, but it doesn't tell you about their skills today, in this moment. It tells us about a point in time. Maybe it was 5 years ago. Maybe it was last year. Maybe it was 20 years ago. And in the video, you saw Daisy struggling to get access to her old curriculum documents. That is very realistic. I'm sure it happens to many applicants. Some of you as participants today might be experiencing that yourself. Thea, I think you just raised your hand. And is it really putting somebody through that process? Is it really giving us the best information? What we're discovering is no, not really. We can do something different. We can do something better. And it's around competency assessment. So show us what you know so that we can fit you into that right designation, and getting really clear that the nursing profession is a continuum, right? I think we've always sort of put ourselves in these boxes. It's fine. And we need to think about how that then connects with the experience of an internationally educated nurse so that they can get to the right job sooner. So we are launching next year what we're calling the IEN Pathway Pilot Project. I'm hoping it'll launch in spring. And our intent is to look at ways to streamline one applicant for one application form with one competency assessment and one pared down credential assessment. So we can save time and save money for the applicant and get them into the right position sooner. So I can't wait to get more information out into the public, but that's what we're working on. And that's an activity that we take seriously, that we know has to be done, not only because of the shortage, but because of the waste in the system of the process. It's like over processing. Peter, you talk about it as the bureaucracy. I think it's even more than bureaucracy. It's putting people into circular loops and never actually figuring out for them that this is not going to get them to the place they need to be as soon as possible. So I'm excited that we are in a position now where we can do this work and talk about it and also challenge those notions of how we've been doing things in the past and move away from the status quo. So thanks for asking about it, Terry.
Thanks, Cynthia. Michael, your association is obviously very concerned about quality of clinicians in healthcare. Any thoughts, any concerns about any sort of simplification of the pathway? Any comments that you want to offer?
Terry, that's a great question. I think the simplest answer at a very high level, there are no concerns. And the reason there are no concerns is that in British Columbia in particular, we know that nurses who are at the point of care have been licensed by the college to practice. And if they have been licensed, then they are safe to do so. And that is the benefit of being a self-regulated profession. And so, we've spoken to the benefits of IENs in the workforce. That being said, we need to balance those benefits with with recognizing some of the risks that are inherent to this process. And there are risks. And so what are those risks? Well, if we rush the process in response to this current shortage that we have, will we run the risk of circumnavigating or short-circuiting the process that ensures that individuals who are practicing at the point of care have the prerequisite knowledge, skills, and abilities to do so safely and competently? If our process is too short or it doesn't align with the needs of the system, how do we match the skill of the individual that is coming from a different country of origin with the requirements for the care in this jurisdiction? And then, we know that our regulator has very clear standards, limits, and conditions on practice, what is required in terms of, competencies to attain those standards, limits, and conditions. So whatever process that we put in place, regardless of the time frame that process takes, and everybody is advocating to shorten that time frame down, it really needs to ensure that the individuals who do end up going through the process come out of the process at the other end and both parties are happy, i.e. the patients that we serve in the province know that they can expect the same level of care that they have become accustomed to. And the individuals who are in the process know that they've met the standard and they can go forward and practice with their knowledge and their abilities without any worry of recrimination. And so, the IENs, they bring a risk to this process as well. I've been noticing in the chat, 5 years to go through the process. That's complex paperwork, costly, $15,000. there is a risk to the IEN in that process if we get to the end and they don't meet a requirement, or there's some small piece of paperwork that didn't pan out, or they missed something in the point system. They've lost all of that time, effort, and ability, and we have lost the opportunity to work with them in the system. So, I think really the key here is in supporting IENs, we need to streamline the process, but we have to streamline the process while we ensure that we maintain safety to practice in a way that focuses on the benefits that IENs bring to practice, but does not inherently work through it too quickly.
Thanks, Michael. Appreciate that. Well, let's hear from someone who's been through the process. Thea Lopez is an internationally educated nurse. Thea, you have a question for our panel.
Yes, thank you so much. Good afternoon, everyone. My name is Thea, and I am an IEN advocate. First of all, I want to thank you for having me, and I am very humbled to be here to be speaking as an IEN standpoint. I want to start by saying let us work on strengths of the internationally educated nurses. Let's bring in experience, cultural openness and diversity, openness to learning new experience, skills and attitude, and bringing in their innate caring traits and ability to thrive and climb regardless of the adversity to the table. As an immigrant arriving in Canada, your instinct tells you to make sure that you have a home in your head, food in the table, enough income to support your family. Getting your credentials done comes secondary because, of course, you have to prioritize survival. I have worked alongside numerous IENs with robust nursing experiences in the Philippines or whichever country they came from. But they would rather work as care aides, grocery personals, nannies, cleaners, because this is what they need at that moment. They know that chasing their RN professional advancement will drain them financially, take much of their time, and emotionally stress them out considering being breadwinners. It's a very hard decision. As an example, I have worked in an acute setting where there are 16 out of 26 care aides are IENs and only 3 of us were doing the process. Similar sentiments you will hear: money draining, time consuming, and emotionally stressful, oftenly described as being headless chickens. IENs would love to be a part of the change and part of the workforce, especially in these pandemic times. But the question is here: how can we better support them, may it be financially or in other ways, to achieve their full potential as an RN? Thank you.
Thanks, Thea. We'll open it up. Thoughts on how we can support IENs in their journey.
Terry, it's Michael. Outside of the reducing the process to get into practice, I think there might be an opportunity for both government and health authorities, as well as the regulator, to work more closely together with educational institutions such as Jeremy's, to provide a mentorship and bridge training program that allows IENs to integrate themselves actually into the practice setting and to learn on the job, as it were, as an RN trainee, and to access a mentor who has added skills and abilities and possibly some supported training to support the IEN through their process. And to ensure that they meet all of the steps that are required to practice safely at the point of care. But it has the benefit on both sides. First, it allows the healthcare providers to have an individual on the job doing the work. And 2, it allows the regulator and the health authorities and government to recognize that, when this person is finished, they will have met the standard. And now you get the benefit of both sides, and they're also getting paid while they're in the process, as opposed to it becoming a drain and they can see an end in sight, whether you want to call it a residency or whether you want to call it a mentorship or whether you want to call it a clinical fellowship or whatever it happens to be. But everybody wins in a scenario where we allow for the individual to progress through the process in a practical manner that addresses needs on all sides.
Thanks, Michael. Peter, the Ontario government, I think, is offering $6,000, up to $6,000 per year support for IENs going through the credentialing process. Have you heard anything more about that? Any positives, or is it too early to tell? And you're still muted.
I'm just going to leave it on, I think, from here on in. I think it is too early to tell, Terry. I think it's a move in the right direction, and it sort of partially defrays the costs. I mean, 6,000 is certainly a help. Now, international, those who come as international students, do get a chance to work up to 20 hours a week. That helps too. There are these factors. I guess one issue, which and perhaps get Cynthia and Michael's thoughts on this, is my colleagues in the U.S. have often said it's much easier to get the international nurses into the U.S. and that they offer more of a likelihood that the nurse coming over will pass ultimately their examinations by offering them, I guess, a facsimile of the exam. I guess it was the CGFN, I believe, abroad. And that if they could pass that exam, they're pretty sure that they could pass the state licensing exams when they arrive. Now, as I understand it, they actually have the full licensing exam available in many cities abroad. And when I look at it, I was looking at an email about that. That exam can be taken in Hong Kong, in London, in Seoul, I believe in Manila, but I'm not sure. I haven't seen that yet. But, the idea is to make it easier for people out there before they come in to know that when they're coming in, they have a really good chance of being licensed and getting through the process. Is that something that we're thinking about doing here? I had once asked a long time ago, somebody in the Ontario College, and I said, why don't we have at least a facsimile of the exam like the Americans do in Manila? He said, well, it's very hard to proctor it. I said, what? Really? So anyway, be
With
interested.
that, we'll bounce that over to Cynthia then for the answer to that question.
Yeah, so the answer is that for the registered nurses, it is the same exam in Canada now as the US, which was quite a transition, as one might imagine. But the NCLEX RN is the licensing exam that we use in Canada, and it is the same in the States. And yes, they can write it internationally at a Pearson VUE testing center. And Pearson VUE has testing centers all over the place. So that has changed. I think the piece, again, I go back to is that process around the credential and the education review and trying to box people in during the application process to an RN versus an LPN versus a care aide or a personal support worker, and thinking about shifting our view of that to say, if you have come with these skills, this education, this work experience, show us what you can do, and then we can find you the right path so you don't waste your time trying for one when you should really be looking at the other. And that, to me, is at least on the regulatory side of the house where we can save some time and reduce some significant costs to the applicant. In terms of the other processes around supporting IENs, I would love to see the Ontario government fulfill, if they haven't already, that commitment to provide some support to the IENs, to defer costs, and to help them get through those processes. I hope our provincial government here in BC might take a similar approach. One can hope. I also think that the opportunity might be now to look at how we articulate the educational approach that we have for nursing in our province. Again, it's very siloed. You choose an LPN program, you choose an RN program, you choose an RPN program. I wonder, I'll ask the curious question, and hopefully I won't get a thunderbolt hitting me from up top there. Why aren't we at least looking at those first year or two of nursing education as similar in common, and then people can sort of off ramp to the psych nursing role, or off ramp to do LPN work for a year or two, and then looking again at how we can integrate IENs who need those bridging opportunities into that educational model. So in my mind, there's like all these different pieces in a very complex system that we need to kind of bring into the room and slowly line it up so that an internationally educated nurse has some clarity in how they move through the process.
Yeah, it's a really good point, Cynthia. And it's sort of combining that thought with Michael's thought about gaining experience and mentorship. I want to call on Patrick McKenzie from the Immigration Employment Council of BC to talk about the FAST program, which maybe addresses some of these. So Patrick, over to you.
Oh, great. Thanks, Terry. I have to say, I'm loving the conversation here, and thank you very much for inviting me to be a small part of it. It really picks up on Dia's point around building on the strengths that an individual brings. And I think that's a really important distinction to make in sort of the settlement or the integration of a newcomer. It's looking at the strengths, what they do bring to the table as opposed to what they don't. And one of our programs is called the FAST program, Facilitating Access to Skilled Talent. And BC Care Providers is helping lead the way on developing competency assessments for sort of critical in-demand occupations in the sector. And it very much builds on those skills. And you may have been you may have had a particular job title back home in your home country, but it's really about what are those tangible skills that you bring to the table today that could be applied in a meaningful way and at sort of their full market value. Ignoring licensure at that point, but certainly aside from that. And I guess, really, I'm hearing stuff both from you, Michael, and Cynthia in particular, that plays off of this and the streamlining of processes and pathfinding, which I think is really critical. This, like the helping people get the information they need to find what's the more appropriate and more likely option for them. And just on the employment side, let alone, as Peter said, around the immigration system as well. But I'm curious as to your views on the place for an assessment like this, so a skills assessment or competency assessment, that to help people enter into sort of adjacent or unregulated roles that make full use of skills, and then ladder up the system into sort of more sophisticated roles as they come along, so you don't have an atrophying of skills. So.
Well, maybe I can take a crack at that, because we've been working, I think, a little bit with your team, Patrick, with our competency assessment process that the Nursing Community Assessment Service offers. And one of the things that we are intending to align is a single competency assessment that assesses competencies for RN, competencies for LPN, and competencies for HCA, all at the same time. So you do one assessment, and at the end you get a report that says you're meeting these competencies amongst these three professional groups. You're most fitted now for this, and if you want to do this or that, here are the gaps that you need to fill. And here are some recommended educational options for you to fill those gaps. Like, if we could get that in place next spring, which is what we're aiming to do, I hope it'll be a game changer for IENs. Because again, the thing that is a bugbear for me is how long they spend in the process trying to figure out where they best fit. And so, as you said, skills start to atrophy. They lose interest. It becomes frustrating, costly, et cetera. And so then they disengage versus getting them through a process sooner, so that they can engage like in the right spot, the right fit in the right moment, with a plan for all those futures that they might want to aim for. So yeah, absolutely. That's what we're hoping to achieve in the next few months and launch as part of the pilot project in the spring.
And I noticed a question in the chat was around provisional licensure or limited licensure. I think that kind of fits with what you're saying there as we assess your competencies, and you can start practicing at this level, and then we'll fill in the gaps, help you fill in the gaps. Government can help fill in the gaps. Educational institutions can help fill in the gaps. Mentorships, as Michael was talking about, can help fill in the gaps and move you up that ladder. So Patrick, thank you for that question. I appreciate it. I want to just touch briefly on and go to Michael and Peter for this, on the ethics of taking healthcare professionals from other parts of the world and bringing them to Canada, where we enjoy a very high quality of life. What do we have to be concerned about in terms of the ethics of taking people from other countries and bringing them to Canada and leaving them perhaps short in the same way we find ourselves at the moment?
Yeah, Terry, thank you for the question. This is one of those challenging ethical questions that doesn't have an easy answer. So I think everybody knows that there are funding imbalances between the G7 or even the G20 and other nations in the world in terms of the amount of resource that they can allocate towards any health human resource designation, including nurses. And that leads to an inherent risk, right, of international recruitment. If it is cheaper to train a healthcare professional in a different jurisdiction and there are less resources attributed to it, then one of the easiest things for one of the G7 countries to do would be to cherry pick the best and the brightest from other nations, because they won't have to fund it. So the International Council of Nurses, ICN, published a position statement related to this very issue in late 2019. And they made a whole host of recommendations. But one of the key recommendations was that they note that it is crucial, and I'm quoting here, it is crucial that all countries train and retain more of their own nurses and implement ethical recruitment practices when they do employ nurses from overseas. The ICN referenced that recruitment must adhere to the World Health Organization Global Code of Practice on the recruitment of healthcare personnel. So, what does that mean, right? What do we say when we say you must adhere to ethical principles of promoting HHR from other countries? Well, the ethical principles are really just a list of opportunities to mitigate adverse effects related to migration of healthcare workers across multiple jurisdictions. Specific ways that you can mitigate those risks are exchanging information openly and transparently so that everyone knows what the requirements are, signing reciprocal agreements between nations to ensure that, for example, we might only take a certain amount of nurses, or there will only be a certain number of physician licenses available to prevent mass movement of individuals from one jurisdiction to another. And then, of course, we have a responsibility as a host country, as a country that has a net influx of migrant health workers, to ensure that we maintain stringent rules around rights and responsibilities and interests of the workers that are coming to spend time in our jurisdiction. And, we've done studies on this, and we've looked at some of the foundational pieces. We've looked at the WHO or the WHO code, and this crisis does not end at the Canadian border. The nursing shortage is worldwide at the moment, right? So, what can Canada do in the context of the larger conversation to try and promote not only equity for individuals who are working in our system, but for nurses outside of our system? So we can push for things like comprehensive nursing regulation, right? If there is a single standard that nurses need to be trained to ensure competent care, then that goes a long way towards, making sure that there is cross availability between jurisdictions, fair and equal pay for the job that's being done. And we know, for example, that some jurisdictions pay quite poorly versus other jurisdictions who pay quite well. Equal treatment for the work being done, and that includes interprofessional relationships within the team, but also includes the way that government and government-like agencies interact with nurses outside of the workforce. And we have to ensure that nurses are being given the opportunity to make choices around where they would like to move, who they would like to associate with, whether or not they would like to work on upward mobility within the profession. And, you know, where they want to work is up to them, not up to, you know, some process or standard that says you must work here for a certain period of time. And then, of course, the last piece, and this has become really important in the post-pandemic world, but ensuring safety. We already have a shortage of trained nurses worldwide, and we're losing more and more of them to the pandemic and as well to unsafe conditions. So, you know, it is beholden on us as a destination country to really push the conversation around ensuring that these standards are met, not just here as it relates to IENs, but also in other countries that relate to nursing in general. So, you know, all this is to say that there are multiple ethical challenges posed by migration of health, human resources across designations and boundaries. But the first step is being aware of the problem. The second step is engaging in conversation around the problem. And the third is coming to a values-based solution that everyone can sign on to. So I know it's a complex ethical question, but I think that, you know, we can we can solve it if we spend a little bit of time and effort diving into it.
Well, thanks, Michael. And I'm just very aware of the time, and we have more subject areas we'd like to explore. We have questions in the chat that we haven't been able to get to, but I know that people are all very, very busy. So one thing we, I guess, need to do is continue this conversation, pull a coalition of the willing together to work with the federal government, the provincial governments, with all of the stakeholders, associations, nursing regulators, industry associations, to really get behind this, because it's clear that we won't meet the challenges in Canada without immigration and international nurses as part of that equation. So I want to thank each of our panelists today, Cynthia Johansson, Michael Sandler, Peter Verkai, and I want to say a special thank you to our sponsors today, Arjo Canada, our title sponsor, our gold sponsors, Point Click Care, and our silver sponsors, the cooperators, Sobeys National Pharmacy Group, Surge Learning, and Care to Talk. And a big thank you to Mike Klassen, Kathy Smoz, and the rest of the phenomenal team, Lara Kroll at BC Care Providers. The Care to Chat series has been so phenomenally well accepted, especially in the virtual world. But we hope it's been informative for you and at least just starts the conversation so we can get some momentum behind some of these very important ideas. So thank you all very much. And with that, I hope you'll have a very safe and reflective Remembrance Day tomorrow in Canada. Thanks, everybody.